Hey everyone, this is Mike Fu, and today I want to talk about neuroplastic pain. I've had a lot of chronic pain, and I still deal with some here and there my entire life. Like my forearms and my traps tend to hurt a lot, and I've discovered neuroplastic pain, and it's helped me a lot. So I want to share it with you. And neuroplastic pain is you can look up the University of Colorado Boulder study. Their researchers and doctors basically implemented, their pain reprocessing and cognitive behavioral therapies, somatic tracking, and I learned this through a podcast. Then I ended up reading a book, and it really changed my life and my perception of my pain. And along the way, it's just kind of enlightened me about, a whole bunch of things about myself and people's health. And one of the things is it's the idea of that pain, obviously, it actually keeps us safe because if you touch something and it hurts, you're going to not do it, which keeps you safe, right? You touch something that makes you bleed, it's going to hurt. And you're going to stop doing that because it hurts. Now, sometimes, and they talk about it in the book and in the podcast, you end up picking up an association where your brain will trigger a pain signal. And this is where I want to talk about the social construct of mental health and the stigma that comes with that. A lot of people, I think after COVID, we've normalized mental health and wellness a bit, more so, but the idea that somebody's in pain and you're telling them it's in their head, it's it could be insensitive to just like the person might react in denial. And I've never had that issue, but I can certainly see um, people who have debilitating pain and who, you know, are going through all this. They want to be able to validate their pain. They want to be able to say, hey, there's a reason for my suffering. And, I don't need anybody's help or whatever, but subconsciously their identity is now attached to their pain. And to some degree, I had some of that as well, and I'll share that later. But one of the things that you have to be open minded about is understanding that your pain is real. The suffering is real. Anybody who felt what you or I felt would understand that, hey, this is not fun. This is debilitating. The cause of it has to do with the stigma part, because if a large proportion of your discomfort is neuroplastic, if not all of it, then you're going to feel kind of embarrassed, right? Like it's not valid to say it's in your head. But the truth is, our brains are so complex, and it is a perfectly valid reason for neuroplastic pain. In fact, a lot of neuroplastic pain comes from people who've gone through real trauma in life. And not only was it physically traumatic, it was mentally and emotionally traumatic. And hence, like, it is very, very valid for people to have neuroplastic pain and know that it's not like, oh, we're calling you crazy or anything. So please understand that understanding the science behind it does not invalidate, somebody's suffering. And so let's get that out of the way first. Now, with that said, tell me about your pain podcast is initially how I got into it, got to learn about it. And I was driving, you know, in my car, and I was listening to a podcast, and the podcast was cool because they had gotten permission to release certain some of their sessions with their patients. The patients, like were like, you can post this, you can record, and you can have this on the podcast. They signed, so that they can clear the HIPAA, regulations and what somatic tracking is and how I can start describing what neuroplastic pain is when you're conditioned with some sort of, well, either it's environmental, or it's something you're thinking about, or something you associate with. It could be a feeling, a smell, an experience, a scenario, but your brain will take that and fire off a pain signal, right? And it's interesting because even when you hit yourself on your elbow, it's your brain telling you it hurts, right? Because if we numb out the nerve pathway, then you're not going to feel the pain because it's from your brain. So all pain is in your brain. That's why it's one of the most hard things to measure. It's completely subjective. Pain is subjective. There's lots of studies that try to, sort of explore that. But with that said, I was driving in my car, and during COVID, I was doing a lot so I'm a teacher, and I was doing a lot of remote lessons. So I was looking down, and I was doing these lessons on my tablet, and I started getting this really terrible upper back trap pain, and it was just like every time where I even looked down a little bit, it would just like fire off, and it'd be like it's like having a headache all day. And I had this for like months and months, and I have other chronic pain throughout my body, but that one specifically was new during COVID. And I was driving my car and I was listening to the podcast, and in the podcast, the doctor was performing somatic tracking with the patient. And what somatic tracking is basically you kind of put yourself in a mindful state, right? Meditation state where you know, slow down your breathing, you focus on your heartbeat, you just basically, and explicitly, tell yourself to make sure you're in a safe environment, and everything's okay, your body's okay, your body is safe. And the reason you do that is because when you feel pain, there's something wrong, right? Pain can come when you hurt yourself. So we want to make sure we understand that at this very moment, your pain, it's you're in a safe environment. So what happens is also along with the mindfulness, you also learn to accept your pain while you're doing this. So you're actually saying it's okay if you feel pain because you're perfectly safe. And you just sort of calmly do this just like you would do with meditation. And then what the doctor starts telling you is, or the therapist is, well, if you feel your pain, let your pain, let it be. Just observe it, you know? And your pain could throb, it could, sort of move around, it could sort of, kind of fluctuate. And what's interesting is we understand, well, doctors and researchers, and we understand that pain should be replicable, right? Like, meaning if you, sprained your ankle, you'll have a very consistent pain. And if you move it, it'll hurt, right? Immediately. And if you move it again, it'll hurt immediately again. Like, it's very reproducible, okay? But neuroplastic pain is interesting because if you're not doing anything and you're telling yourself you're safe and you're in a nice meditative state, you're calm and the pain is there, you start noticing that it moves, that's actually a sign that it is neuroplastic pain. Because if mechanically something was very wrong, you should only feel the pain, either it's consistent or you can cause it by like moving your arm when you fractured something, right? Like you should be able to do this to make it feel pain, to make it hurt. But if you're not doing anything, the pain should be, it shouldn't be moving around from your left trap to your right trap, right? And it's that cognitive realization and affirmation that disassociates sort of the subconscious part of your brain firing off the pain signals to a conscious part, which is like, oh, my body is actually safe and my brain is actually misfiring the pain signal. And while I was listening to the podcast, listening to the doctor do that with the patient, I was following along driving, and I was freaked out because while I was driving, my pain in my upper left trap, whatever, it was moving around, it was whatever. And all of a sudden, when I realized this, my pain went away. I was like, whoa, what the hell? And it just blew me away because um, once I understood that concept, I was able to do the somatic tracking more, and just meditate more, and basically reprocess the pain, right? Train my body to unlearn that association with, like, whenever I'm doing work, and I'm specifically, in this environment, that I start feeling this pain. That's another way of actually helping people with therapy, which is, they'll have people be in perfectly safe environments and tell them, hey, just imagine yourself, doing XYZ when you feel the pain, right? So you could be sitting down, perfectly calm, perfectly safe, but they'll say, like, oh, it's when you pick up boxes, right? So imagine picking up a box, like standing over it, bending over, picking it up. And if you actually start feeling pain as you're thinking about it, it's neuroplastic pain. And once you, sort of cognitively and actively come to that realization, you can train your brain to unlearn it, right? And it's interesting because it's a process, because not everybody's pain is the same. Not everybody's associations and how it's connected is the same. So, for me, it was kind of crazy because at some point I had an appointment. I made an appointment to see a neuroplastic therapist, or somebody who would, address neuroplastic pain. And I ended up booking that appointment before this car ride, listening to the podcast. And I ended up going online. It was a virtual one, to that appointment, and I had to tell the therapist, like, actually, I think I'm better. I still talk through it and ask questions to learn more from a clinician standpoint. And it was very helpful. She was telling me about other patients and all the other ways people can experience this. But I didn't need the appointment after that. So I was just like, hey, I don't need any more appointments. For me, the podcast was actually enough to get through and learn some of the techniques that they used. But I also was confused as hell because I've been dealing with so much chronic pain in other parts of my body that I addressed other parts as well. And people who go through pain know this. It's like you start associating yourself with your pain, and you don't know how it feels to wake up in the morning and not be in agony and not feel like, just like I wake up with my forearms always just as if, you know, like like I said, it's like having a headache all throughout your body, right? That's how chronic pain is for me. And so I have it on my forearms, I have it on my SI joints and my lower back, my upper back, and I've improved a lot. I still have pain here and there, but it's much more manageable. And it was confusing for me to experience no pain or the absence of it, because it's like I didn't know what to do with myself. I bet it's like, when if somebody, couldn't see and they all of a sudden one day they could see, it's like, to be pain free or to have it so much more manageable is just something that, it's a human thing. So I want to just share the idea of neuroplastic pain, because it, it it's something you don't necessarily need to even go see a doctor for in the beginning. You could research it yourself and learn a lot about it. Um, and you know, mainstream medical practices, uh, we are very drug pharmaceutical based, capitalistic society, and so the system is broken. I feel for so many patients and doctors, because you know evidence-based medicine is in itself, it's become sort of influenced in a negative way because of big pharmaceutical companies, because of all the money that goes into drugs and pills. And we need kind of a paradigm shift, because it'd be cool if everybody, just like a dentist, if we put our medical spending on, everybody sees a dentist every, few months. Well, how about everybody has a therapist session every month or every other month? Like, and to have neuroplastic pain be a rule out diagnosis, because in that, in the Colorado Boulder study, 2/3 of the participants in that research study ended up feeling better. And so if you take a lot of the people who are seeking out drugs, who are seeking surgery, or you know and there are people with with mechanical musculoskeletal or neuro, sort of related discomfort, that is, that is what it is. It's not saying, oh, like, it's just, it's a rule out, right? Like, if you explore neuroplastic pain, if you understand that and you give it a chance, hey, at least there's a chance if you happen to fall into that category, then now you're saving yourself doctor's visits, you're saving yourself, like, obviously you're improving your life because you have less pain, but also, you never go down that pathway of possibly having to look into drugs and the addiction and all of that. So I think therapy, just in general, would be great for everybody. But of course, we live in America, so there's a lot of things in the system that work against this. But I just want to share this because this is evidence based, science based, and doctors right now have so little time to actually engage their patients, to make them feel like they have the time to be listened to and they're in a safe environment. And the system is just broken. And I really wish that we could, this paradigm shift of having mental health and wellness, including neuroplastic pain, sort of be, the first in line, right? To our health and wellness. And obviously we still have, our annual checkups and everything, but neuroplastic pain is just, is such a breakthrough. And it's just not, I don't think people know about it enough. So I'm just throwing it out there in this video because I think it deserves way more attention. Um, it's potentially lower cost because it's not a procedure, it's not a drug. Although drugs, if it's addictive, they'll be cheap as heck, right? Way have it in our system. But it potentially is more time with a therapist and whatnot, but that's all good stuff, right? It's all preventative, right? It's, if you have less pain, you're more likely to exercise. If you're less pain, you have more energy to go do things and be productive. You're less likely to be depressed, right? So neuroplastic pain as a first type of checkpoint for helping people, and you don't have to be a specialized clinician. We have therapists that can be trained with this, and so there's only so many medical doctors, but we do have more therapists that can have great impact. They already have profound impact being therapists for people for their day-to-day lives, but in terms of pain, people always then associate that with having to get surgery or having to have painkillers that are addictive. So I think the paradigm shift um, would be wonderful if we can get there sooner than later. But obviously, being informed and knowing about it is important. So that's why I made this video, and I hope I think this stuff is really really cool and fascinating. Hope you enjoyed that. All right, peace.